Our group consists of Andre, Dominique, Micah, Olnika, and Riza. Today, we will be discussing personality disorders and then focus on borderline personality disorder.
What is a personality disorder?
A personality disorder is an enduring pattern of inner experience and behavior that opposes the cultural norm of the individual, is pervasive and inflexible, usually evident at the beginning of the adolescent period or early adulthood, and becomes dormant over some time, leading to distress and impairment. There are several personality disorders including avoidant, obsessive-compulsive, narcissistic, borderline and antisocial personality disorders. We will focus on borderline personality disorders today.
What is borderline personality disorder?
Borderline personality disorder is a disorder of neuroticism including traits such as emotional instability, vulnerability, overwhelmed, depressive, and self-destructive. It also includes patterns of instability in relationships and moods, self-image and impulsivity, and which commonly begins during early adulthood.
What other characteristics are there?
Other characteristics include identity disturbance, recurrent suicidal behavior, gestures, or threats, chronic feelings of emptiness and impulsivity.
What factors contribute to the development of borderline personality disorder?
Risk factors include hereditary predisposition and invalidating family environment.
Who is likely to be diagnosed with this disorder in the Caribbean?
That's a great question. According to a study done in Jamaica, 2/5 of the population met the criteria for diagnosis of a personality disorder. It is interesting to note that females are at least 3 times more likely than males to have borderline personality disorder.
Are there any treatment options?
Yes, treatments for borderline personality disorder include dialectical behavior therapy, which is a form of cognitive behavior therapy. The dialectical behavior therapy is one which has been advanced to be quite expensive as it lasts a long period of time, but whose benefits are far-reaching.
Is that the only option?
No dear. Mentalization therapy is also used to describe common psychological processes that people use to understand mental states like emotions, beliefs, desires and intentions that underlie their interactions. Medication has also been proposed to treat some of the symptoms of the disorder.
That concludes our presentation. We hope that you have found our presentation educational. Thank you so much for listening.